Namaste. Today I'll discuss about some difficult scenario teachers or parents may encounter in school or at home with their children. Now, as far as parenting is concerned, raising children is not about the style of parenting, it is about the outcome. Most of us as parents and teachers are also parents. Most of us, I have seen that we tend to follow our own methodology. The parenting methodology that we follow is mostly based on our own childhood experiences. And the methodology that was followed at that time and the methodology that has to be followed at this time may be slightly different. Now, when you become a parent or a teacher, dealing with the children doesn't come with a user manual. You need to develop a lot of managerial skills to deal with different kinds of situations in your classroom or as parents in your house. There is actually no right way to parenting. As all children are different individuals, their needs are different. So the way you parent them also should be dependent on the situation. But sometimes the situation is so difficult that parents and the teachers are at loss how to go about solving the problem or how to go about handling a situation. For example, if you suddenly find your child or inside the classroom, if you find your student is indulging in undesirable activities, for example, use of drugs or anything like that, or watching some content in the social media that is not appropriate to his or her age, or even more difficult situations, what should be the approach towards that I am going to discuss now. First and foremost, I would advise parents and teachers not to panic in a situation like this. You have to be patient. Of course, we have to solve the problem, we have to make the child understand. But if the child is, if the teacher or the parent is himself or herself emotionally dysregulated, you may want to solve the problem, but you may actually escalate the problem because you may be saying things that you never wanted to say. So first and foremost thing is have patience and see that your own emotions are in a regulated manner, that you're not angry, you're not upset upset about anything, and you're normal. Then in the case of teachers, if you are able to discuss it with your colleague or somebody and then bring the child to a place where the child is alone and you are there you want to discuss it with the child alone, that is fine. In the case of a parent, if both the spouse, the father and the mother, both of them sit together, discuss the problem and think about how to sort of bring about this topic in front of the child, that will be fine. instead of one parent going and trying to sort out the problem and the other parent not able to understand what exactly is happening. So in a difficult situation like this, the first thing is that you should be emotionally regulated. Second thing that you should be aware of, or you should be thinking, is that don't ambush the child. Suddenly don't present the situation or asking questions, him or her questions, that this is that, and the blame game starts then. So sit, both of you sit, the parents or the teachers should sit, make the child also sit and discuss the problem calmly, and tell the child that I am able to see what you are not able to see at this time. Tell the child that we all care about you, we all love you, and we want that your future should be successful. So for that, this kind of behavior will not help. So you have to tell the child calmly what the child is not able to see, because he or she is behind whatever that is, behind that, and they don't want to leave that. So we have to make the child understand what will be the implications of using this kind of material in the long run. Next thing what the parent and the teacher should understand is that don't expect immediate results. Whatever you want to tell the child, tell in a calm manner and let it marinate inside the child's mind for some time. And immediately don't expect results. Wait for some time, be patient. Sometimes it may take one day, sometimes it may take 1 week, sometimes it may take 1 month also. So keep monitoring the child in these situations and then see the results.